Okay, copy your mayday. Command to the right. I need you to go to the number 2 floor. Look for the officer of trucks.
Firefighters are injured every day. Our first priority is protecting ourselves from injury and taking care of each other when injuries occur. We have trained on removing injured firefighters from the ideal H environment, but we have not learned how to remove them from their protective gear. In order to perform a thorough assessment, it will be necessary to remove the firefighter's gear. There may be times when gear does not need to be cut off, but can simply be pulled off. When removing a firefighter from a high heat environment, the gear should be cooled prior to handling. Firefighter gloves or leather work gloves should be worn until the gear has sufficiently cooled.
Prior to the methodical removal of firefighter gear, it is imperative that we address immediate life-threatening injuries and/or conditions. Some things to take into consideration are early oxygenation, preferably with a non-rebreather mask and high-flow oxygen, maintaining the airway, and maintaining inline C-spine stabilization manually.
Begin by removing the firefighter's regulator and helmet. Be sure to carefully maintain manual C-spine stabilization throughout this process. Remove the SCBA shoulder straps by feeding them through the slide bar. If firefighting gloves make this too challenging, cut the webbing using trauma shears. Unbuckle the waist strap. When the firefighter has been fully released from the SCBA harness, gently pull the SCBA away from his body and place it to the side. Maintain C-spine stabilization and roll the firefighter onto his back. The first rescuer can begin opening the bunker coat by gently pulling apart the Velcro and opening the metal buckles. He can then undo the belt and open the Velcro of the pants. Meanwhile, the second rescuer cuts the hood, beginning at the firefighter's chin and working downward. As EMS arrives and begins preparing oxygen, the second rescuer cuts the straps used to tighten the facepiece mask as close to the release point as possible, still using the trauma shears. Lift the mask straight up off the face and slide the netting out from the back of the head. Oxygen should be applied via non-rebreather mask to ensure proper oxygenation. Removal of firefighter clothing can now be addressed, beginning with the gloves. Burns to the hand are a common concern for firefighters. Evaluate the injured firefighter and try to determine if there is potential trauma to the hands before attempting to remove the gloves. Is there damage to the gloves? Ask the firefighter if he is able to move his hand. Is there any pain? If none is present, remove the gloves by pulling them off from the fingertips. A cut may be made in the gloves to try and visualize if there is injury to the hand.
This is a firefighter's gear that we have already cut. The reason you would want to cut the gear is because the firefighter could potentially be unconscious or have injuries where they're unable to self-extricate. You can start your cutting based on where they have a complaint or you have a high index of suspicion for injuries. The gear itself is actually made up of 3 different layers. The 3 layers consist of a PBI outer shell, a vapor barrier, and an inner quilted thermal layer. It is hard to cut all 3 layers at once, so start by cutting the PBI outer layer first. The vapor barrier and the thermal layer can be cut at the same time.
When removing the bunker coat, begin by cutting the sleeve at the wristlet. Cut through all 3 layers of material until you finish cutting the sleeve well. Once the sleeve well has been cut, separate the outer PBI shell and cut it by itself. Cut the drag rescue device when it is visible and continue cutting up the sleeve and then between the storm flap and the collar. Return to the base of the sleeve well and begin cutting the inner 2 layers. If it is too difficult to cut both layers at the same time, separate the vapor barrier and the inner thermal layer and cut them individually. Cut parallel to the seam of the coat, avoiding reinforced areas such as seams, patches, or pockets. Remember that you may need to alter your cut lines based on the injuries present. Special considerations may be taken when the firefighter presents with specific injuries. Burns are an injury where you may need to change your plan on removing gear.
As we think about stopping the burning process, we need to remove the firefighter's gear. Special care must be taken when removing the firefighter's gear, because if it is adherent to the skin, it can pull skin and soft tissue off when it's removed. If we encounter gear that is melted and stuck to the firefighter's skin, care should be taken to cut around that location, leaving it where it is until it can be removed at the burn center.
Be sure to cut around an area where you suspect there is a burn. Cut one layer of protective gear at a time, ensuring that there is not any material adhered to the skin. Leave any material attached to the skin and do not attempt removal. Try and preserve the damaged area of the gear for inspection, but do not allow this to delay treatment or transport of the firefighter. Visualize the burn to determine its approximate extent and severity. Bandage the injured area and treat per protocol. Transport to the burn center. Expose the firefighter as much as necessary to perform a trauma assessment and to determine injuries. As the two rescuers are exposing the upper body of the injured firefighter, additional personnel are removing gear from and assessing the lower extremities. To remove the suspenders, cut the loop that is attached to the pants. Cut the pants using the same technique utilized for the bunker coat, beginning with the outer PBI shell. Cut parallel to the inseam, avoiding knee pads and pockets, and continue up the leg until you reach the Velcro flap. When finished with the outer shell, cut the two inner layers together. Again, if this is too difficult, you may separate the vapor barrier and the inner thermal layer and cut them individually. The technique for cutting the boots will be dependent on injuries that the firefighter has sustained. If there is a lower extremity injury, attempt to cut the boot shaft down the leg toward the foot as far as you can. Stay slightly off-center, careful to avoid the shin protector. This assists the removal of the boot without causing excessive movement or further injury. After the gear has been removed, use the trauma shears to remove the station uniform so that a proper and more extensive assessment can be performed to identify and treat traumatic injuries or medical conditions. Once an injury has been identified, treat per protocol. Use procedures such as the 12-lead ECG, capnography, pulse oximetry, or RAD-57 as applicable. Transport the injured firefighter to the facility most capable of treating the injuries with which he presents. If the firefighter has been burned, transport him to the burn center. Carefully consider whether ground or aerial transport will provide faster arrival at definitive care.
The Taking Care of Our Own Gear Removal Training Program is an outstanding opportunity for Fairfax County Fire and Rescue Department to engage in some excellent training that hopefully will develop some best practices, possibly some protocols. You know, practicing in a controlled environment is so critically important versus having to have to do something such as gear removal from a burned firefighter, one of your colleagues that may be traumatically injured or just have a separated shoulder. So important to do that before we do it in the real environment. So this training program, as with every training program that the Fairfax County Fire and Rescue Department develops, is extremely important in terms of taking care of our own, developing local, regional, and possibly national best practices and even protocols associated with gear removal of an injured firefighter or a burned firefighter. So please, let's all engage in this training. We practice so that we play in the right environment. And remember, what's most important here is that Fairfax County Fire and Rescue Department is known for its training. And as I always say, train, train, train.
Man, engine 427 of your car. 27 is off. Man, truck 422 of your car. All right, exterior of the building. Copy, Division Alpha. All crew members from the crew that declared the mayday are accounted for. I'm going to get them back to the building now.